What would it take for the United States to become the best health system in the world? No, better yet, the best health system in the history of the world. I'm going to share 10 key actions that within 30 years, the United States could become the best health system in the history of the world. My name is Chad Swanson. I'm an emergency physician, and I'm on a journey to understand and transform our health system. The Commonwealth Foundation recently published a report comparing the United States healthcare system to other upper income countries. And not surprisingly, we came in last, but not only last, but well beyond. We're an outlier. We are lower than the other 9 countries compared by a long shot. Now, the steps that I'm going to share are best done synergistically. So what we really are interested in is reaching a tipping point, a point at which there is a critical mass of people, there's enough momentum that there's a shift in the institutions, in the mindset, in the assumptions, in the paradigm under which we function. So we saw that happen in health and medicine in the 1890s and the early 1900s. We've seen that happen in business. We've seen that happen in politics. These paradigm shifts happen when there is a critical mass that leads to a tipping point. So this is a messy and unpredictable process. So I won't share any blueprint. I'll share actions that I believe if we undertake them, and on the one hand, you'll see that they're very ambitious. On the other hand, if we look at history and things that have happened in the past, from the founding of our country to the recent shift in the way that we view LGBTQ people, we are capable as a society of undertaking major shifts in the way we act as a society. So it's a messy and unpredictable process. There are 2 overarching ideas that I want to emphasize. Number 1 is the importance of a shared vision. So a shared vision of optimal health and well-being for all at the lowest possible cost. That vision is too often in the background. It too often takes a backseat to politics or to specific interests or to profits or to a research program or a health class or licensing requirements. There are so many activities and areas of focus that get in the way of the vision. So that's the first overarching idea, is the importance of this shared vision. And then secondly, that our incentives align with that shared vision. Okay, from least important to most important, and the caveat, of course, is that these are just my thoughts today. They will likely change. There are many people out there that will have different ideas, better ideas. So I hope you'll speak up, and I hope to add something to this conversation, maybe spark a conversation, catalyze a conversation. Just want to keep this important topic front on our minds. So number 1, automatic, basic, free, universal health coverage. It is time. We've played around with this topic too much. Regardless of your political persuasion, I think that Finkelstein and Einov in the book We've Got You Covered make a compelling case, but there's lots of other compelling cases. We need automatic, basic, free, universal health coverage. Number 9, abolish fee-for-service. So we've played around with fee-for-service enough. It's not working for us. We need to, and there is obviously lots going on with value-based care. People that know much more about this and are much more engaged in this than I am. But the more we can shift towards incentivizing financially and otherwise, there's non-financial incentives for population health at the lowest possible cost, then we will be motivated and acting and innovating towards what we really want. Just to mention a few of non-financial incentives, so job security, recognizing people in their jobs, benefits, location. There's a lot of things that motivate workers that don't necessarily have to do with money, but money is obviously very important. Number 8, competency-based medical, nursing, and other health providers licensing. So we currently have a system that's over 120 years old. It's kind of like building an engine. It's a factory model where we say, okay, we need X number of physicians. In order to get that number of physicians, they have to go through at least 7 years of training. that model was set up at a time that's vastly different in so many ways than our world today. Today we have physicians associates and nurse practitioners, some of whom have practiced largely independently in a setting, excelling in family practice and orthopedic surgery and lots of specialties. And so to think that they would need to go through 7 years of education and training to practice at the level of physician makes no sense on a systems level. They could get to that level in maybe 1, maybe 2, maybe 3 years, and that's a discussion that warrants lots of weight and criticism, but it makes absolutely no sense on a systems level. There is a tremendous amount of knowledge and experience that we have in our system that we are not utilizing, and that could lower costs and lower the overall resource burden of our system. Number 7, I would require a health systems transformation major for all pre-med students and at least a minor for all other health professional students. So currently a physician, a pre-medical student, so a student who is planning on attending medical school, can major in anything. I majored in philosophy, you can major in music, you can major in architectural design, you can major in anything you want as long as you take a certain number of science classes, biology, chemistry, physics, etc. I think that there are definitely advantages to that. Having said that, I think that our need is urgent enough that we need every health professional to be conversant in probability studies and statistics, in the history of our healthcare system, in epidemiology, in the forces that truly drive health, in the financial aspect of health economics, and other topics that are crucial for physicians and other health professionals to understand as they enter the health workforce. Now, there are some that can and do include those courses into nursing training or physician training, and there's just not enough time to give. Those topics need justice, they need thought, they need analysis and a deep understanding for health professionals. So I would require every health professional to major or minor in health systems transformation. Number 6, all community organizations and religious organizations, civic organizations that are embedded in their communities, many are doing tremendous work related to health. I would engage in a advocacy movement to inspire and lift those organizations to be even more involved in the determinants of health. So ranging from social isolation to poverty to racism and other topics that are impacting our health. Finally, the wealthy and funders and philanthropies, I think we need at least $400 billion. I came up with that number because I took the top 100% in our country and I said, okay, what's 1% of that? And I just vaguely thought of the numbers, but we need a large amount of money that is set aside explicitly for health systems transformation to bring about all these other things. And I would recommend a funding process wherein interested organizations, communities, and even states prepare proposals that they would then competitively apply for funds through a health systems transformation fund. 4, I would organize transformational health groups at every level. So whether it be in a city or a hospital or a clinic or a university or a state, so every entity that has a mission and that receives funding or that has specific activities related to health, I would recommend that they form health systems transformational groups. These would be groups that consider how all of these other activities are impacting their local group. Number 3, related to that, I would elevate, recognize, pay, listen to the 10% or so, I don't know if it's 10%, but There are people in your organization, in your state, in your hospital, wherever you are, there are people that are passionate about transformational change. And some of them sit in the back of the room and don't say a word. Others get fired because they're trying to make change too quickly. Others are quite effective at making change, but we need to elevate, and many are come from disenfranchised and disadvantaged backgrounds. All of these people need to be elevated. Their influence needs to be elevated. So if there's a board meeting or a physician group meeting or a university academic department meeting, those meetings where we close the doors and we make decisions that determine the activities that we're engaged in, we need to invite and include and elevate the influence of the transformational leaders that are in our communities. Number two, all of this transformational change would require a paradigm shift from a biomedical reductionist model, wherein we primarily focus on the biological and medical treatment of disease and only considering the specific parts of the body or specific parts of an organization or specific parts of the whole of the system. We need to shift to a complex adaptive systems perspective wherein we consider all of the parts, how they interact over time and how they influence health, grounded in health and well-being for all at the lowest possible cost. So that would result in, we need to understand the many tools and principles of complex adaptive systems. We need to understand that command and control policies result in unintended consequences long-term. We need to identify those surprising and unanticipated emergent phenomenon that happen all the time in complex adaptive systems, and reward innovation that's aligned with our vision. Finally, the most important action point to become the best health system in the history of the world is to develop a shared vision around optimal health and well-being for all at the lowest possible cost. We do this through relentless storytelling, influential people, whether it be musicians or leaders or politicians or sports figures or celebrities or disadvantaged people with stories to tell. We need to inundate our society. It's already happening to a large degree, and many of you who are listening now are engaged in telling these stories. We need to do it 10 times more. And we need to shift our entire societal and national mindset to one that's oriented around health and well-being for all. So as a reminder, this vision and aligning incentives with the vision, I think, is the most important action point, and nearly all organizations at least mention a vision of optimal health and well-being for all, and at least consider that. But what I think is needed if we want to create the best health system in the history of the world is to elevate that vision above profits, prestige, rescue treatments, and other motivators that are driving our system today. I would love to know what you think. Please criticize, please comment, and look forward to an ongoing conversation.